Right, continuing on in your infection or mechanism of disease chapter, we are on page 124 in your anatomy book, picking up with prevention and control, right where video 3 left off. So how can we avoid all those diseases that we talked about in this chapter? Some are preventable, some are less so, because we can only prevent what we know to do. And so some of them are air spread. So like the rhinovirus, the different coronaviruses that cause the common cold, those are in the air. And so if you know somebody is sick, certainly you can protect yourself, kind of stay back, or hopefully they're protecting other people by, sneezing properly and washing their hands, things like that. But sometimes we catch it from people who don't realize they're sick yet. Like we see with some COVID, you're infectious before you even know you have it. Or chickenpox, you're infectious before you even know you have it. So it's hard to protect yourself from that. Some viruses are direct contact, like hepatitis and AIDS are direct contact with bodily fluids, and so you can certainly protect yourself there, especially in healthcare when we're dealing with patients who may have some of those diseases, to protect yourself. Talks about the definition here between sterilization, disinfection, antisepsis, and isolation. Okay. And so a lot of people don't realize there's a big difference between a disinfectant and a sterilizer. So you got to kind of look at the cleaning products that you are purchasing as to which one we're even talking about. So like if you're using like Lysol wipes, what exactly is that? If you're using pure alcohol, what exactly is that? And so what does it kill? Okay. So of course, opportunistic invasion is there has to be a way into the body. I could come in contact with blood with somebody who has hepatitis or AIDS, but if I don't have a cut on my hand, there's no opportunity for that virus to get into me. So there has to be a way in. And other times the opportunistic invasion is that we have different things on our skin but can't get in until we have a cut. And so it talks about the fungus that causes athlete's foot is often on your skin and you don't even know it. Like you have it, it's just not activated. But then when the foot gets warm and moist, that fungus starts to flourish because you gave it the environment that it wanted. The vector, that's that biting insect. Lovely, more pictures of bugs. Okay. So you can see the different bugs that they're talking about, different symptoms, different diseases that it causes. We already talked about spores. One thing we did not talk about was bioterrorism. Following 9/11, there was a lot of concern about bioterrorism and anthrax being used as a weapon and things like that. And that's where the spores can be really scary, is if somebody wanted to use that as a weapon, it could easily be transmitted to a large amount of people. Let me see what I have here. Spores form from bacteria, not viruses. A good little note to add. Vaccination, of course, is one prevention. We have vaccination for a lot of diseases. Now, there has been a big pushback with vaccinations over current years. There's a lot of people who are anti-vaccination. I say do your own research and make up your own minds. However, vaccinations have saved millions of lives, even if it has caused side effects in some people. And there's a lot of dispute over the rest. I'm not getting into that. Do your own research is what I say. And it's still the CDC recommendation. Treatment certainly there's a variety of medications that can treat bacteria, such as penicillin and other antibiotics like that. For those who are allergic like me, I can't take penicillin, but I can take streptomycin. But if you have a virus, we certainly cannot give you something to kill the virus. What we can do is treat your symptoms, we can make you comfortable, and we can shorten the length of the virus infection. And so those are going to be antiviral drugs. Again, doesn't kill it. So specifically, acyclovir is good for herpes. Efavirenz is for HIV. Tamiflu is good for the common cold. Okay. And a lot of times we have drug cocktails, which means that you're taking a combination of medication. That's where your cocktail word comes in. Okay. Cancer. Okay. Cancer literally means new growth, new tissue. Benign and malignant are the terms that are used on whether or not it's cancer or not cancer. Benign is not cancerous. Malignant is cancerous. And you'll need to know those again when we get into coding. And the difference between a cancer tumor and a non-cancer tumor, you can see there how fast they grow is different, whether they're in a capsule or non-encapsulated, whether it spreads, and your risk of mortality or death is definitely different between the two. The word metastasis or metastasize means to spread. So if somebody has cancer, let's say they have liver cancer and it spreads to their brain. So it metastasized to the brain. A lot of words for tumors. Some cancer and some are not cancer. Papilloma, adenomas, lipomas, osteomas, osteosarcomas, myeloma. The more you do with these, the more you will familiarize which ones are cancer and which ones are not. Anytime you see the word sarcoma or carcinoma, they are cancer. Absolutely. But I don't want you to think that it has to have those terms. For example, melanoma is cancer, but it doesn't have those two terms, sarcoma or carcinoma. It's just melanoma. So it's easy to think that melanoma might fall into the same category as these up here, but it doesn't. So you need to make sure in coding that you're coding them properly and that you know whether it's cancer or not. Causes of cancer, again, are very similar to our risk factors for any disease that we talked about earlier. Genetics, our age, the environment, those are the same as the risk factors we've already talked about. However, carcinogens is a chemical that we expose ourselves to, like smoking, like asbestos in the construction industry, and other things we cannot control, because sometimes viruses turn into cancer, like HPV can turn into cervical cancer, certain strains of HPV, not all of them. Different ways to detect cancer, certainly self-examination. So women are you're encouraged to do self-breast exams. Men should be doing self-testicular exams. If you notice something on your skin, get it checked out. If you notice something on your spouse's or partner's skin, don't think that they saw it. It might be here on my back. How in the world am I ever going to see it? And if you don't tell me something's there, how am I ever going to know until it gets really serious? We can do a variety of x-rays, MRIs, CAT scans, things like that to detect different internal tumors, ultrasounds as well. And then a biopsy. That's where we go in and we actually take a tissue of the tumor so that we can test it. So while we might be able to do an MRI to see the tumor, we still don't know if it's cancer or not. We then have to get a piece of that tissue and do the biopsy. Sometimes we can not have to be so invasive for a woman, like we can do a pap smear and we can get some of those cells without really invading the body too much. And we didn't have to use a needle or any kind of a surgical test. Sometimes we can do it through blood tests, like the different blood cancers, like leukemia, things like that is blood. And then what can we do to treat it? We can do chemo and radiation, different laser therapy and immunotherapies, and of course surgery, we can cut it out. But a lot of times they like to shrink it before they do the surgery, so tends to be a combination of treatments. All right, inflammatory response. You step wrong, you twist your ankle the wrong way, you have a sprained ankle, and it gets inflamed. It's an accumulation of fluid to minimize damage further to that ankle. Okay, we want you to stay off of it. Okay, so usually your tissue injuries will be inflamed. 4 primary signs: redness, heat, swelling, and pain. I don't have a whole lot to say here at the end. That's it. That's your chapter. Review your chapter tasks, do your practice tasks, do it yourself, test yourself, do these. Oh, look at this wonderful matching on your diseases, multiple choice, fill in the blank. When you're ready, come back and do the review questions that are a little more challenging. These are excellent review questions to test yourself on.